So welcome everyone to our webinar today on the economic abuse among senior immigrant women. We are so pleased to be hosting this webinar with WomenACT, the Women Abuse Council of Toronto. Before we get started, I would like to provide our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. Before we get started, I have a few housekeeping items just to go through. As everyone is probably familiar with, all attendees will be muted during the webinar. Our speakers will be visible during the presentation as well as during the question and answer session. We are pleased to have our ASL interpreters here today, both Cindy and Amina. They will be changing periodically through the session. I will try to spotlight them so you will have a better visual of the translation as or interpretation as we go through the presentation. You can, on your own screen, make your images larger by pulling the line between the presentation and the speakers to the left, or you can put it into your own speaker view on your own screen. We would encourage you to put comments, if you have any, into the chat box. If you have a specific question for our speaker, please post that in the question and answer box. It makes it easier for us to make sure we don't miss your question. And we will get to that at the end of the session. We have built in time for a question and answer session with our guest speaker. And the session is being recorded, so it will be posted on our website later today with all the other resources that our speaker will be sharing with us today about the report and other resources. And at the end of the session, we will appreciate your feedback, providing some information on how the webinar was through an evaluation survey. So we would appreciate taking a couple minutes just to fill out that evaluation form. And just lastly, we do respect privacy and confidentiality for individuals, as this is a public forum. We are here to support individuals. If you have a personal situation you'd like some further assistance with, we would encourage you to reach out to us after the webinar, either by email or phone to the office, and we'd be more than pleased to provide some assistance. We just want to respect your confidentiality in terms of conversation. So you can keep things in more of a general term if there is something, just in terms of not identifying sort of names, but we will try our best to assist, as I say, during the presentation, if there's a general questions, and then if there's something specific, one-to-one makes it a little bit easier and more, we can have more in-depth conversation after the session. For those who are joining us for the first time for our webinar, just to give you some background, Elder Abuse Prevention Ontario is a nonprofit organization where we envision seniors to be free from abuse, have a strong voice, and feel safe and respected. And we achieve this mission through raising awareness, providing education and training, and working with many community organizations to increase our capacity and outreach and advocacy for seniors issues. And we implement Ontario's strategy to combat elder abuse. And we do that through those three priorities that I just mentioned around awareness and education and training and working with our providers. So we do a lot more robust things under each of those components. I encourage you to look at our website because there's many initiatives, programs that we provide to individuals in the community as well as service providers who are supporting seniors. So it gives me great pleasure to introduce our keynote speaker for today, Premila Chaparrala. She is the project coordinator for the Women Abuse Council of Toronto. Premila has worked in the violence against women sector in multiple jurisdictions and projects, including the criminal justice and legal sector, shelter services, crisis and community services. She has a Master of Science in Criminology and Criminal Justice and has an interest in the intersectionality of gender-based violence research. She's currently leading this project that she's going to speak to us today about with WomenACT on senior women's experiences of gender-based violence and on the intersections of employment and safety amongst racialized women in Toronto. She is also working on those projects. She's quite busy. We are so pleased that she's able to join and share her findings that they've been doing, which is an Ontario-based study. And I'm going to let her talk to you about the work that she's been doing, but I think you'll find it very interesting. And we haven't had many webinars, particularly on this issue, especially just focusing on economic abuse. So I hope that you are able to learn some new facts and maybe get connected further or involved in some of the projects that they are doing, which Pramila will speak to today. So I'll leave it to you, Pramila, to share your screen and start the presentation.
Thank you, Ryan, for that lovely welcome. And I'm very grateful to be here today and grateful for Elder Abuse Prevention Ontario for letting us share our research findings. I'll just start sharing my screen. I'm hoping that you'll be able to see my screen. Ryan, I also noticed there's quite a few comments on the question and answer section saying that they are not, yeah, okay, thank you. So as Ryan was saying, today I'll be talking about senior immigrant women at risk of economic abuse. This was a research study completed by Women Abuse Council of Toronto, or WomenACT. And just quickly about WomenACT, we are a policy and planning body that works to end violence against women and advance gender-based gender equity through research, policy, education, and system coordination. We envision a world where all women are safe and have access to equal opportunities, and we do that through that policy, education, and system coordination as well. So the webinar today will be based on a report WomenACT completed as part of our project on senior immigrant women, risk of economic abuse. This project was funded by Government of Canada's New Horizons for Senior program, and the report includes both a literature review on this topic and research findings from a small-scale study that we completed. Before we start, I'd like to just say that the topic we're covering today might be upsetting and uncomfortable. If you do have to reach out for support or take a break, please do so. And you can also chat or message Rayanne directly. So today we'll be answering a few questions. One is, how does gender, age, and immigration impact economic abuse? What economic abuse can look like for senior immigrant women? What is the impact of economic abuse for senior immigrant women? And how to respond effectively to senior immigrant women experiencing economic abuse. Before I start, I wanted to go over a few terminologies just in case they are not useful, not known to people. So when we speak about gender-based violence, this includes any harmful acts directed at an individual or group of individuals based on their gender identity, gender expression, perceived gender, and/or their sexuality. By economic abuse, we mean any acts of control around finances, harming someone's access to finance resources, and harming their ability to exercise and engage in economic activities such as find a job or get education or language skills to be able to get a job. By intimate partner violence, this includes any form of abuse in the context of an intimate relationship, such as spouse, a partner, or in a dating relationship. And it can include emotional, verbal, psychological, sexual, and physical forms of abuse. So I'd like to start us off with a poll that should appear in Zoom. And this one, I'd like you to think about what factors you think impacts abuse in senior immigrant women the most. And you have a few choices there, so I'll give you a few minutes to complete the the poll.
Just give it a couple more seconds. People are still voting.
No problem. Hey, interesting. Everybody said all of them equally. That's very interesting. And yeah, most of you have recognized that all of gender, age, and immigration in some way influences economic abuse. And that is something that we found in our literature review and in our study as well. So I would like to spend some time now looking at how gender, age, and immigration can impact economic abuse. So in the same way that we can see how someone's gender shapes their experience of abuse, so this might be what the abuse looks like, the prevalence of it, how victims or survivors seek help, and the barriers to seeking help. Research also shows that age and immigration can uniquely shape the experience of abuse, including economic abuse. Looking at gender and economic abuse, we know that gender impacts women's economic security, and in older age, this can have a more pronounced impact. So women are often in a more precarious financial position because of a lifelong impact of gender inequality. So more precarious jobs, less paying jobs, and the gender pay gap. And this can increase with age. For example, in 2017, the gender wage gap ratio in Canada for women who were 65 and over was 3.9% higher than for women aged 35 to 44. Another way in which gender can have an impact on senior women's economic security is through the compounded impacts of economic abuse or financial abuse and abusive relationships. And this can limit their income, this can limit their savings and or pensions. For example, a study from the US estimated that the lifelong cost of intimate partner violence was $103,767. This cost was causing women poverty and also keeping women in poverty as well, especially senior women. Now, looking at age, it can further shape economic abuse. According to statistics from Canada, approximately 7% of seniors reported that they had experienced some form of emotional or financial abuse within the past 5 years. And financial abuse seems to be the most common form of elder abuse through many studies. What is unique to seniors experiencing economic abuse is that they are at more risk to experience abuse from multiple perpetrators at the same time. So this might be adult children, caregivers, and spouses. Age also impacts supports available to them. So due to age, older women face added barriers to financial independence, such as ageism in the labor market. So a recent study in North America stated that 81% of survey participants believe that their age was a consideration in the hiring process. And half of those that said ageism was an issue were in the age range of 55 to 64. And lastly, the experience of immigration also shapes economic abuse in multiple ways. So one way is through the sponsorship rules. So Canadian parental sponsorship rules have an economic dependency requirement on adult children for 20 years. This means that if during this time the sponsors, so the adult children, neglect or are unable to provide for their parents, the parents are in a financially unstable position. Also, they are unable to claim a pension for 10 years after they move to Canada, which again makes them very reliant on their sponsors. Because of immigration, there might also be a lack of knowledge of systems and rights, which leads to reliance again to others, often the abusers who sponsored them. There might be a lack of knowledge of the language, which again creates further barriers for independence and for them to be able to seek help. Further, immigrants may face discrimination in employment, so not recognizing non-Canadian certificates or non-Canadian work experience, which again impacts their ability to be financially independent and secure. So when we think about how senior immigrant women experience economic abuse and the impact of the factors impacting them, they face an intersection of all of these factors, and these have a cumulative impact on the experience of economic abuse. So I'll turn now to what those experiences of economic abuse can look like. And that's mostly from our research study. So just wanted to have a quick note about our study. It was a small scale study that was completed between September 2021 and January 2022. We used semi-structured interviews, and these were held with 3 senior immigrant women with lived experience of economic abuse, and surveys were held with 6 community organizations and service providers. The research findings are limited by the small sample size. The study experienced a number of barriers because of the difficulties of engaging senior immigrant women, even though their voices are very important, it was difficult to engage them. As such, this study is not intended to reflect a comprehensive view of senior immigrant women's experiences. However, many of the experiences they shared and the themes that they shared are reflected in literature review elsewhere. So I will start us off in this topic with another poll. It should appear in Zoom soon. In what ways have you heard of economic abuse being spoken about in different communities? And you should have a few examples there. Okay, so we have results. Children's financial abuse and financial control. Present not at all. There's some financial disrespect and financial mistreatment as well. So a bit of a range, but mostly financial abuse and by financial control. So this is something that we found in the literature as well in our study, is that there was different types of terminologies used to describe economic abuse of experiences. And it was identified differently across different communities. The definitions were usually closely connected with gender norms related to household roles and decision-making about money, and this differed across cultural contexts. These gender norms could normalize abusive behavior, and in some cases make it difficult to understand and identify economic abuse by service providers. I've included here some examples of how economic abuse was spoken about by participants. So one who was spoken or described as a lack of choice around finances. So this might be lack of just access to finances and how to use their money. Also as not being able to have economic rights. So for example, access to economic activities such as getting a job and having other economic rights such as information about their finances, or also like having access to necessities. Another way of speaking about it was very connected to cultural standards around obligations to provide. I have added a quote here that might illustrate some of that point of how culturally contextual understandings of economic abuse can be. So here the participant was saying that my culture, it says that the breadwinner controls the money. I wasn't working, so I didn't touch the money. If I needed anything, my husband, he brought it, but here we need it, but don't know how to get it. So in this case, the participant explained that she accepted her husband's control in the country of origin, so his control of the money in the household, because he was the breadwinner, but he was fulfilling his responsibility to provide for her. So it followed cultural norms, so she didn't consider that abusive. However, she perceived her adult children control over the money, so the same control of the money, to be abusive because they were not providing for the family, even though they had responsibility to do so. So that shows you some of the ways in how complex these definitions can be, how culturally contextual and based on those norms they are, and why it might be difficult for service providers, especially not entrenched in that culture, to identify economic abuse in their work with survivors. Another factor we found from our research that was also mirrored in the literature review was that economic abuse against senior immigrant women could be perpetrated by multiple sources. So service providers and participants mentioned experiences of abuse from partners and spouses, adult children, grandchildren, extended family and carers, and they could be simultaneously experiencing these, the different sources of abuse. Senior immigrant women could have experienced different sources of economic abuse through their lifetime as well. So for example, first in their youth from a partner or spouse, and then in their older age from adult children and extended family. And they also mentioned that often multiple people in the family were aware of the abuse and could either normalize it and minimize it and be part of it, or would try and prevent it. However, this would be difficult if the supporting family member would be in a different country from them. What was interesting was that regardless of the perpetrator, was also the abuse, the experience was also always gendered and ageist. So it was based on specific attitudes and beliefs that the perpetrators held about women and money, or older people and money. On the slide, you can see another quote from a service provider that shows one of these attitudes. So she was saying that senior women can be seen as not understanding or having the need to access money. So that could be both a misogynistic attitude around women and money, or an ageist attitude around older people and money, or a combination of it. The source of abuse also had specific impacts on survivors. Women shared feelings of grief and disbelief about their adult children's behavior particularly. It also created barriers to addressing economic abuse, as they didn't want any negative consequences against their children. So now that we have looked at some definitions of economic abuse and the sources of economic abuse, I'll now be looking at the different types of economic abuse that was shared by service providers and study participants. We've divided these into the following groupings. Firstly, service providers and participants shared multiple examples of abusers controlling their finances. So that might be withholding money, not having access to money, because their adult children or partners kept their bank cards, or because their money was put into a bank account that was not in their name. Also controlling the amount of money, so that might be through an allowance, not being aware of how their money was used. So one study participant shared that she was often not aware when her adult children were using her bank card. And the way the perpetrators were able to control survivors' finances was often through physical force or emotional manipulation. Coerced fraud was also mentioned as a common experience. So this might be taking loans without their full consent or knowledge, opening bank accounts without their full consent or knowledge, applying for benefits in the woman's name, and forcing them to sign documents they did not understand. Women reported that their adult children would often take advantage of their lack of knowledge or understanding of systems, or lack of language skills. So one participant shared that her adult children were able to apply for social benefits without her knowledge, because when they went to meetings to workers, they were the translators in those meetings. So they were able to misrepresent how much she was entitled to and how much money she was getting, and only gave her a small portion of it. It was only when she started learning English and with support that she realized what they were doing. And the next one, exploitation, was a unique risk faced by senior immigrant women and was very much based on gendered understandings around care roles. So service providers shared examples of their clients being exploited for childcare, so caring for grandchildren, or house care purposes after they moved here. And caring for grandchildren was often normalized and expected across many households, and it was not always considered abusive, but did kind of cross that threshold to be abusive, where it impacted their health, how they could spend their day-to-day lives, or the time that they had. If control was used, emotional manipulation, or threats were used to keep women working. So that's when it crossed the line. Another common experience of economic abuse was withholding basic necessities. And this often had serious impacts on their quality of life. So this could be withholding food, withholding clothing, which especially had an impact in the winter if somebody is coming from a warmer country, withholding access to transportation. So that might be not giving them money for transportation, or withholding medication. This form of economic abuse can cause serious health impacts. For example, for one participant, her lack of access to food and medical care eventually left her with a permanent disability. And we also included isolation here because isolation was spoken in a very particular way by service providers and participants. So it was described both as a key cause and a consequence of economic abuse. So it was either an intentional type of abuse by the abuser, so a tactic to maintain economic control. So for example, not letting women learn English, not letting them look for a job, also preventing access to supports by not providing transportation intentionally, or being hostile to service providers if they try to phone them or try to visit. And in one participant's case, slandering them to their support network or their community, so they were completely cut off. What is important to know that all of these forms of and types of economic abuse, they weren't experienced in isolation from other forms of abuse. And they were often intertwined in those other forms of abuse. So participants experienced emotional and verbal abuse linked to money and control of money. They experienced threats of violence, serious threats of violence, threats to cut them off from grandchildren, especially around exploitation. And they also faced repercussion from addressing their economic abuse. So that could, again, be a risk of violence or threats. Now that we have looked at what shapes economic abuse and what it can look like for senior immigrant women experiencing it, I'd like to spend some time sharing how it can impact senior immigrant women. So the impacts and consequences of economic abuse that was discussed in this study included emotional forms, psychological, and physical impacts. They described a loss of social connection and networks, and this might be as a practical consideration because of the language. It might be intentional because of isolation tactics by the abuser, or again, practically because of the immigration experience. So when they moved here, they might have lost their social network and their community and haven't been able to rebuild it because of those language barriers or because of isolation by the abuser. Loss of freedom was mentioned as another common impact. So this would be loss of decision-making around their finances, which very closely linked in terms of how they were able to spend their time in day-to-day life, often through financial control or exploitation as well, if they were expected to spend most of their day providing childcare or house care. Loss of financial status and increased risks of poverty. So a lot of the times when women moved here, they might have been working before, or they might have had a higher quality of living or finances and lost it all when they moved here. So they lost employment opportunities, lost their savings and pensions because of economic control. Another impact was deteriorating health. So this might be exhaustion through exploitation, lack of nutrition, and medical care from withholding necessities as well. And participants also mentioned a number of emotional impacts. To have a few listed there: depression, fear, and also many mentioned helplessness as well. So women were often felt helpless to change their situation and felt resigned to it. So service providers and participants shared that economic abuse could have significantly changed their quality of life. For example, one participant explained that she had lost her job when she moved here. She had lost her social network and supports, and she couldn't recover these because of the isolation by the abuser, and also the health impacts caused by the economic abuse, which meant she was no longer able to work. And her experience left her feeling helpless and actually caused her to, in the end, have suicidal thoughts. With such significant impacts, it's important to find responses that work specifically for senior immigrant women. And that is what we'll be looking at next, is how service providers and participants discussed effective responses to economic abuse. So, do another question. What barriers do you think senior immigrant women face when trying to seek help? And this time, this is not a poll. You can just put your answers to the chat. We'll take a few minutes just to see how people feel. I'll just repeat the question. What barriers do you think senior immigrant women face when they are trying to seek help? Okay, let's see. Language barriers is being a common one. Information about resources, knowledge where to go, knowledge of their rights and services, lack of knowledge of information systems, no access to resources like families, transportation, yeah. They don't want to bring a bad name to the family, yes. Let's do a few more seconds. Yeah, so consequences to the family. Yeah, so a lot of people saying language and not aware of resources. Main barrier. Stigma as well, yeah. Okay, a lot of people kind of identifying quite a few barriers. They were also identified in our study. So women and service providers identified significant and cumulative barriers to senior immigrant women seeking help for abuse or obtaining financial security, and you've mentioned quite a few of them. So language barriers was the most common. Lack of culturally competent services. So senior women wanted services where they felt who they felt comfortable with and where they would feel understood and not judged. Lack of knowledge of services and rights, that was mentioned by quite a few of you. So this created an isolation and reliance on sponsors and abusers for information about services, and this could be used against them. Also, sometimes this might be because the women had no reference points for some services, because the services in their own country of origin was so different, so they wouldn't even know what to look for. For example, one participant didn't know that there was such a thing as income support. She understood it in terms of charity. Lack of knowledge of services and rights, yeah. Types of banking services as well was one thing that senior immigrant women said that they didn't understand, because again, it was very different in their home country. Fears of repercussions, so I think that was mentioned in the chat in different ways. So fears of negative consequences to their family members. A lot of them also mentioned fears for their immigration status. So they feared either because of threats by the abusers or because they didn't understand their immigration rights, that something might happen to their immigration status if they reported anything. They also had fears around confidentiality. So again, either that what they shared with them would go back to their abusers, or they generally had a mistrust of authorities. Lack of Canadian experience and recognition of non-Canadian qualifications was a major barrier for them being able to become financially independent or seek a job. Lack of finances as well. So that impacted their ability to access services because of transportation, because of food as well, in case they had to travel a lot, and in clothing. Again, in wintertime, they might have not had appropriate clothing, so they couldn't access services. And that might also be in terms of phone access as well. So what were some of the recommendations that came from the study? So firstly, culturally and language appropriate services was important to participants and service providers. Addressing women's access to services and isolation through targeted outreach in places where senior immigrant women, even in their isolations, might go to. So service providers said that even when women were experiencing abuse isolation, they still accessed faith and community organizations. That might have been the only place where they saw other people. So having some targeted outreach in those places. Addressing women's intersecting needs through wraparound service model. So because Women needed settlement services, they needed help with the abuse, they needed help with the control, they needed help with their rights. So a lot of intersecting needs. Participants and service providers discussed having one worker that could do a wraparound service as the most effective one. So one participant described how she had one support worker who got her a phone so she could talk privately with them without the abuser listening in, helped her to identify and read financial documents so she was able to identify what her abusers had applied for in her name. The worker helped her open a private bank account, and the worker also helped her to secure safe housing. And the participant said it was because that this one worker helped in all these different practical aspects and also the abuse in housing that she was able to escape the economic abuse. And service providers also suggested increasing women's knowledge of their financial and immigration rights, so this couldn't be used against them. Education on services and resources in general. And lastly, service providers wanted more capacity building for themselves to understand those culturally contextual definitions of economic abuse and what would be available, like what resources would be available in the community for them to pass on to their clients. And we have actually compiled some resources that are available for free for service providers and survivors. So these are available through our website. I can put the link to the chat later on as well, and I think Rayan is going to upload it on EAPO's website as well. We have created information leaflets for senior immigrant women in 11 languages that have examples of what economic abuse can look like, so that they can identify it, and also some instructions on how to seek help, basic helplines and how to actually make the call. We also have audio versions of these that are available on YouTube in the same languages, because we understand sometimes senior immigrant women might better understand audio recordings. Another way in which you can be a part of our work with senior women, we have a new project called AGES, so Agent, Gender, Equality and Safety. We're hoping to look at what awareness raising is needed in community around those intersections of gender and gender-based violence in senior women. We're currently looking for volunteers with lived experience of gender-based violence, so not just economic abuse, of women who are 55 and older and would like to do some awareness raising activities in the community. So again, you can access these on our website in WomanACT. I think now we have some time for questions. And you can either put these in the chat or feel free to unmute yourself as well.
Participants can't unmute, but if you have a question, I can promote people to speak if you put your name in the chat and if you'd like to ask a question. I'm just trying to put my, there we go. Sorry. So if you have a question, somebody was asking if the videos are available in French.
We don't have any at the moment in French. However, if there is a language that you're needing them, that you want to provide for your clients, please do reach out. I'll put my email address here as well, because we are looking for other languages that we can translate those resources to.
There's a question about how many women were actually included in your research, and did you detect any differences between women from various countries?
So it was a very small scale study. We're only in the 6 months that we tried to engage participants, because it's a very niche community of people. We only got 3. And there wasn't a difference in their experiences. The only difference was maybe some of those definitions. But in terms of the types of economic abuse that they had, they were pretty similar. So regardless of the culture, they experienced the same types, but the way they understood them and the way they find them was very different depending on their culture.
The leaflets, I believe, the information leaflets are available in French. I did post in on the chat the languages that were available, and there's multiple languages that's been translated into.
Yeah.
French is
Unfortunately, I don't
it's
think.
not listed.
Yeah.
Yeah.
Unfortunately, French isn't one of them, but please do email me because we are looking to maybe translate them in more languages. So if you do have one, and I think that WomanACT said French, so we can look into that.
The one question that, just listening to your really informative that presentation, was just the issue around ageism came up. And I just wondered, is there any work being done to address the issue of ageism with immigrant communities, or with immigrant senior women, or the younger generations, to address some of the things that you brought forward?
So I haven't seen any personally. When I was doing the literature review as well, it was there was limited research on it, and I think because it's very difficult to engage senior immigrant women, particularly because of those language barriers. Also, culturally, some cultures don't want to speak about those kind of experiences, and there is stigma attached to it as well. We approached service providers that did work with seniors in terms of even kind of social aspects as well. In there, they would talk about ageism at some point, but not very directly like this. So some of the barriers experienced when accessing research participants is service providers said that it was a difficult topic and they didn't want to upset the seniors in their groups. So that might be another aspect as well. It's not really talked about that much.
Okay, there's another question here. According to you, does level of education of women play any role in financial abuse?
It doesn't seem to be at all. So in terms of the research position we had, again, it's a small scale study. It was only 3, but there were different levels of education. So some who might have not been educated and relied on haven't worked or hadn't gotten an education. Others who had an MBA and had more successful businesses as well. So it doesn't seem to play a role in that.
Okay.
I think that the things that do play a role is gender, that immigration and age.
I don't see any other questions yet. The other question I had was, you mentioned the example of a senior woman that was in Service Canada getting assistance, and the translation wasn't what she was saying. How is there services that senior immigrant women can access for translation who are non-partial, or like an agency that would provide that service, so they don't have to rely on a family member that may not be translating what they're actually saying, whether that's medical appointment or Service Canada or wherever? Yeah,
so normally local community services will have support workers that can attend appointments. Depending on the community service, that they have different services they can do, but that's why it's important to have language and culturally appropriate services available for women, because they're able to go through the appointments with them, handle the paperwork, understand the paperwork, and accurately translate as well. But normally, it's the local communities that are either from the same culture or from the same language.
And those are free usually?
They're free. So in the information leaflets, this was for Toronto based, but we put the number for 211 specifically so that women could access the local culturally appropriate and language appropriate services. But they are normally free. It depends on what's available. So I'm not always sure what's available in other like across the provinces, especially in rural areas. So it might be more difficult. But in Toronto, there's quite a few that are very language-based or culture-based services.
Yeah, someone did post the multicultural immigrant, I think it's immigrant services. We've used them in the past for other things that we've done. So I know that they do that. And I'm not sure if it's free or not, but that'd be something that we can add to the website, just as a resource for people to access and get more information, unless you know more about that, Pramila.
So I do think that the MCIS language services are able to access internet services for gender-based violence issues. So it depends on how the service is set up. So it might become a problem if the service is completely set up as like an income support. But I'm not 100% certain on that, but they should offer free interpretation services for any issues impacting gender-based violence.
There's a question. Can you comment on the role that existing sponsorship requirements might have on economic abuse? So individuals who have been sponsored by families to come to Canada?
Yeah, so I think I mentioned earlier on that there is an economic dependency requirement. The sponsors have to provide financial support for 20 years for anybody that's sponsoring, so usually grandparents. There's also a rule that says that anybody moving in, they cannot access any pensions for at least 10 years since they moved. And both of these kind of create basically dependency on the abusers. So it helps with that isolation and works towards that isolation that abusers can use against them. And also it means that they don't have the freedom to break away from the abusers because they don't have any access to other financial resources or able to financially support themselves.
Thanks. And there's another, just a question. What should immigrant women do that flee abuse but don't have any documents with them, though necessary to open a bank account? So they may not have, let's say someone takes their passport, or someone, you know, they don't have a health card, they don't have any ID or any of that. Is there options for them if they want to get out of an abusive situation?
So I do know that some service providers will help women, especially in general, women fleeing violence, as they often have to flee violence without any documentation. So they can help them contact embassies and start that process in terms of getting copies of their paperwork. I think some gender-based violence organizations, such as the Barbara Schleifer Clinic, can also help in terms of providing immigration lawyers again, who might help with some documents.
Thank you. If anybody else has any questions, you can post them. The other question I was just thinking about was, you know, thinking about the intergenerational aspect of families, and you did allude to some of that with the adult children. Is you know, similar to the other talk about education around ageism. Is there anything being, you know, work with intergenerational with the younger kids, just around, you know, the respect and recognizing kind of the basic warning signs, or just sort of that education about aging and in general?
I have not seen any. I do know some community organizations are trying to do more befriending services. So like befriending with an older person and a younger person as a way to kind of combat that ageism, but not in terms of education in a sense. However, that's what we're hoping, not in terms of the intergenerational aspect, but just hoping to educate the community. That's what we're hoping to do in our next project. And we are, so all of the volunteers for that will be women, all the women who have experienced gender-based violence after the age of 55, and hoping that they will design what they think the communities need to hear about this topic. That's not necessarily just for economic abuse, but gender-based violence in general. But I do think there's a bit of a stigma in terms of kind of addressing gender-based violence in senior women. And one, that might be because of a culture of being private and confidential, that you don't air your dirty laundry in public. Oh, thank you. Apologies for that. I didn't realize it. Yeah, and also in terms of not upsetting senior women as well. So one thing that we heard just when we were doing this research project was that a lot of senior women, even participants, so we had a few more who were going to join us and do the studies, but they were often in crisis because they had those high barriers of being able to leave, and because of their old age as well, they might have not wanted to leave their adult children to just cope with it, but it meant that we weren't able to access them to, you know, be part of the research project. Also, service providers found it difficult to help them as well and access them. So it might be that engaging them in general is difficult.
I just wanted to put up your contact information. I think everybody can see that. Is that right? Make sure. Just to let everybody know that where they can reach out to find further information, to the website, follow you on Facebook. All the social media channels are being posted, and there's as indicated before, Pramila is also involved in other gender-based violence research, which might be of interest to people as well. So the website has quite a few resources available for people to download. The links that we talked about on the chat will be posted on the website for people to access as well. And Premila, I'm not sure if you want to talk about the volunteer advisory committee that you're looking for volunteers for.
Yeah, so that was to raise awareness in the community. So we are seeking for women who live in Ontario, are 55 and older, and have experienced gender-based violence as a woman who's 65 years or older. And what we would ask you to do is do monthly meetings with other survivors and design those awareness raising sessions in the community, however you think is an effective way to do that, and also what topics you would like to cover. So if you're interested, we are starting with the first meeting in August, but we still have spaces. So you can contact me by phone or by email is probably best.
Great. And I have posted information on the website about that too, or you can find it directly on the WomenACT site as well. Just to follow up for people, if they want further information about other webinars that we've been doing, and we haven't got any other webinars coming up until September just because of summer with August. Many people are on holidays, so you can check out our website for some of the tools and resources that we have available, and other past webinars. And as I say, after this webinar, I'll upload the session to our site, so you have access to that. And the website is eapon.ca. We do, as I say, we have some resources like under our fact sheets and tools. We have directories. We do have a module around emotional abuse. You know, we haven't updated that in a while, but it's based on some of the work that you've presented today, including maybe the new research around that cultural, the intergenerational violence, the intersectionality around cultural immigrant senior women. It would be important to add as well. And then we have also some fact sheets on financial issues that we've been talking about today, how to protect your finances. So there's different options available for people to access as well. If someone wants to reach out for support, they could call the senior support line that's available. It's offered by the Assaulted Women's Helpline that's available for seniors or anybody who's looking for assistance. And again, just a reminder, we do have our evaluation. So if you wouldn't mind taking a couple minutes at the end, just to give us your feedback, we would greatly appreciate that. And if you want to reach out to our organization, this is my contact information. And you can find us, all of the staff people that are on our team on the website as well, with our emails and phone numbers. So I want to thank you, Premila, and our ASL interpreters again today for joining us. We do appreciate everybody today coming and joining and sharing your questions and your comments with us. I will share some of the chat box with you, Premila, too, because I think there's some good comments around some languages for different items to be translated, which I know that you're looking into. So I'll share that information with everyone as well. So thank you so much. Everybody have a good summer, and we will see you in September. Thank you again, everybody.
Thank you, everyone.